Hey guys, this is a example follow-up visit. This would be like our second visit with Cassie. Of course, we filmed the first one a couple minutes ago, but we're pretending I haven't seen her in a few days. And the second visit is kind of like, really, it's like the first visit is its own thing, and then the second visit or the thousandth visit is kind of the same. Maybe the second visit's a little different than the third, fourth, fifth through the after that, because you're kind of checking in after that first visit. But in general, visit 3 and on is pretty similar, and visit 2 is kind of like 3, etc. But you could say it's a little different because you just adjusted them once. You're kind of checking in. So this is going to be a second visit. Okay. Okay. So I'd say, hey Cassie, what's up? How you been doing the last few days? How do you feel from your first adjustment? Let me just ask you, how's your knees doing?
They're doing a lot better. I still have a little bit of pain, but it's not as bad as it was.
Okay, do this for me. Let's take a scale of 0 to 10, and we'll pretend 0 is when we started, and we'll pretend 10 is like your knees are totally healthy. They feel perfect 24/7, no matter what. Where are we now?
Probably like a 7.
Okay, awesome. Did it kind of go to like an 8 and fall back to a 7, or just like went to a 7 and stayed there?
Went to a 7 and stayed.
Okay, cool. How about the wrists? Let's do the same scale. How's your wrist doing?
Same thing. They're probably like an 8.
Okay.
I'm not feeling too much.
Okay, and on the wrist, did they kind of go to a 10 and fall back to an 8, or they just like hit 8 and just stayed?
They hit a 10 and then fell back.
Beautiful. So far, we're making all this up, of course, because I adjusted her a couple minutes ago, but this is realistic. We're pretending I'm seeing her 4 days or so after that first visit. She's telling me that her knees are about an 8, with 10 being perfect, and they just went to 8 and stayed there. And I'm sorry, was it the 8 or, yeah. And the wrists are also at an 8, but they actually went to like a 10 for the first couple of days and then fell back to an 8. And how about I know you only were having heartburn twice a month, but I'm assuming your digestion's been,
Yeah.
okay, cool. And you have not had your cycle in the last 4 days, right? So we can't check up on that. Okay. So, I'm checking with the patient, like I'm checking those things. I'm kind of making it clear to them those things are all going to be at a 10. I just want to see where are they so far. That's the expectation. That's the vibe. That's the implication. All that stuff's going to be at a 10. 100% healed. I just want to see where it is so far. And I would tell her on that, on the wrists. Very often people will get the first couple adjustments and they'll have that surge to a high number, then they'll fall back a little bit. They don't fall all the way back to where they started, but they'll fall back a little bit. That's just because we haven't created the stability yet. But after the third, fourth adjustment, we get that stability. Then wherever you get to, you just kind of stay. So it's like every adjustment, you just keep going until you're at a 10. And then I would also make it clear to her that, of course, even though she didn't have her cycle in the last 4 days, I remind her that, in a couple cycles from now, I expect her cycle to be perfect. And even though she was only getting the heartburn twice a month, and I only saw her 4 days ago, I would make it clear to her that if we're sitting here in 2 months from now, she'll be telling me that, or I expect her to tell me that the heartburn is just deleted out of her experience and her digestion is perfect. So I say, let me adjust you now, so go face down, please. Now I'm not really gonna impulse on the bones because I just adjusted her in real life, but we're gonna kind of pretend. So remember last time she was a acute 3 with a chronic 5. If I haven't explained that stuff to you, I will, and if I have, you already know what I'm talking about. I cleared 3, which also had a clearing effect on 5 because all the systems are interconnected. So I'm going to say, okay, let me check the zones, and I do 1, 2, 3, 4, 5, 6, and I'm going to pretend that I feel 3 and 5, but they're both improved. They're both tender, but not as tender as they were before. And I say, okay, Cassie, I'm going to continue to work on zone 3, continue to clear your nervous system. I already told you that adjusting your neck is going to help your wrist heal, adjusting your low back is going to help your knees heal, plus I'll check those too, and clearing your nervous system, and I kind of remind her about the cycle and how it has an effect on digestion, and I'd even throw in, hey, and by the way, it's good for your sleep and your immune system. And we actually give out little pieces of paper that tell the patient what they can expect from the adjustment. So of course, they're getting that anyway just to make clear to them and create that image of health on that specific zone. And I might mention to them, hey, by the way, I do feel your muscle system, it's kind of old, it's kind of chronic. We're going to work on 3 till it's clear, or as long as it shows up. And then if we have some of the muscle system left over in the next few weeks or whatever, we'll clear that up too. So then I do the adjustment, I do the knees, the wrists. I would adjust the knees and the wrists on every visit until she was completely healed with those. There's some exceptions to that, but that's for the most part. Then I go back, check the zone, it's clear. Then I'd sit her up and I'd reiterate, hey, you're doing much better. I expect all those things to get to a 10. Let's keep up on her twice a week. I'll see you in a couple of days. You'll update me how you're doing, and we'll take it from there until you're all better. See you soon. Thanks, guys.